Hey everyone. Today I want to dive into a topic that's been gaining some attention recently, the potential long-term effects of the common antidepressant Prozac when taken during adolescence. Specifically, could it lead to increased pain sensitivity later in life? Now, Prozac, or fluoxetine, is an SSRI, a selective serotonin reuptake inhibitor, is often prescribed to teens dealing with depression, anxiety, and even eating disorders. But a recent study in the Journal of Psychiatric Research examined how this drug might affect pain sensitivity if used during those crucial adolescent years. Researchers conducted this study on female mice, giving them fluoxetine in their drinking water for 15 days during their adolescence. They found that these mice exhibited increased sensitivity to pain in adulthood, weeks after the treatment had ended. This was determined using the hot plate test, a common method for assessing pain response in rodents. But that's not all. The fluoxetine-exposed mice also had lower body weight in adulthood compared to those that didn't receive the drug. This weight difference started during the treatment and continued long afterward, indicating some lasting changes. So what's going on here? Fluoxetine influences serotonin levels, and serotonin is crucial for regulating mood and pain. By altering serotonin during adolescence, a critical period for brain development, there might be lasting impacts, particularly in areas like the prefrontal cortex, which is involved in emotional regulation and pain perception. The study also touches on inflammation, another piece of the puzzle. Fluoxetine may affect inflammatory markers, which can also play a role in how we experience pain. Clinical research has shown that children and adolescents treated with fluoxetine have elevated inflammatory markers. But let's be clear, this study was done on mice, and while it raises important questions, we can't directly translate these findings to humans just yet. However, it does highlight the need for more research, especially considering the rising fluoxetine prescriptions among adolescents, particularly girls, during and after the COVID-19 pandemic. It's also worth noting that fluoxetine is used to treat various conditions beyond depression, like eating disorders and premenstrual mood symptoms, which themselves can affect pain sensitivity and body weight. This makes it even more crucial to differentiate between the effects of the medication and the underlying conditions. So what does this mean for parents? If your teen is taking fluoxetine, it's important to have an open dialogue with their healthcare provider. Discuss any concerns you may have and weigh the benefits and potential risks together. Always consult a professional before making any changes to medication. In summary, while fluoxetine can be a lifeline for many teens struggling with mental health issues, it's essential to stay informed about its potential long-term effects. More research is needed, but being proactive and engaged in your child's healthcare can make all the difference. Thanks for tuning in. If you found this information helpful, don't forget to like, comment, and subscribe for more insights on health and wellness. Take care and see you next time.